All right, great. Thank you very much. Thank you very
Yes,
much, everybody, for your patience, and welcome back again to the DY Patil PG lecture series. It's again my proud privilege to welcome you back, and we have Dr. Alpa Alure today with us, who shall be speaking to us about psychological testing in psychiatry. Since this is an extensive topic, we have split it into two parts. One of them will be covered today, and the second half will be on the subsequent Thursday evening. So we have two back-to-back Thursdays lined up for you. And today, to do the honors of chairing and moderating the session, we have with us Dr. Janvi Kedare. I have known her since our post-graduation days, and she was my registrar and also a dear friend of mine. And it's my privilege to welcome her to this platform back again. Dr. Janvi is an additional professor of psychiatry at the TNMC and BYL Nair Hospital. She's been with the field of psychiatry for more than 25 years now. Her areas of interest are geriatric psychiatry, community psychiatry, ethics, and research. And currently, she is also the president of the Prevention of Sexual Harassment Committee at the Topiola National Medical College. She is a convener for the Clinical Practice Guidelines Subcommittee of the Indian Psychiatric Society. She's the chairperson of the Awards Committee at the Indian Association of Geriatric Mental Health. She is a member of the Institutional Ethics Committee at even TN Medical College. She has been the past president of the Bombay Psychiatric Society. She is the secretary for the Indian Association of Geriatric Psychiatry in the past as well. She has also been secretary of the Bombay Psychiatric Society. She has more than 35 publications to her credit, and she is involved in a whole bunch of public awareness programs through the print as well as the technological media. She is on various programs on various platforms, and not only is she a brilliant psychiatrist, she is a very, very humble person and a very warm person. And like I said to you, it's my proud privilege to call her not just a professional colleague, but also a very good friend of mine. And we are happy to have her with us. And I will request Dr. Janvi to take over the proceedings of the evenings and take it forward. Over to you, Janvi.
yes. Thank you so much, Rashmi. First of all, thank you for such kind words, and let me congratulate you on this sustained effort of PG teaching, and that too such varied topics and faculty which is renowned from all over the country and doing a lot of work in the area have been on this platform and given lectures, and I'm sure it has been of great help to all the postgraduate students in psychiatry, not just in Mumbai, all over. And I'm sure the practice of keeping the lectures on the website has also helped in disseminating a lot of knowledge to people. Uh, Today, let's talk a little bit about today's lecture. Today, we have a very important and what should I say? A very important topic from the point of view of practice, be it in an institution or private practice, where we advise a lot of psychological testing, sometimes because we are in a dilemma, sometimes because we want to be doubly sure, many times because we think that there could be a medical legal problem, and also because there are some medical legal issues that our clients face. There is a major reason for which nowadays we advise testing, and that is certification, especially with the new Rights of Persons with Disability Act. Certification has become an important process, and for that also psychological testing is of much use. And to give a lecture on psychological testing in clinical psychiatric practice, we have a very able person, Mrs. Alpa Alure, who has been a senior psychologist in Sion Hospital for the past so many years. And so she is the right person to give this talk with the background of her clinical experience, and I'm sure a lot of medical legal experience also that has uh, gone in so many years. She graduated in 1985, got a fellowship at Jai Hind College for a year. She completed her master's in psychology in 1987 worked at Indian Council for Mental Health for 1.5 years. She also worked at Nair Hospital as a lecturer in audiology and speech therapy department, worked at MT Agarwal Municipal General Hospital in the Department of Psychiatry for 3 years before she came to Sion Hospital, where she helped to set up the department as a develop the clinical psychology department in Sion Hospital. Since 1994, she is in Sion Hospital, and her area of interest is teaching. So we have the right person, a teacher who's going to teach us about intelligence tests. She conducts workshops and lectures on multiple platforms, including for OT, PT, nursing students, and also at undergraduate students. She takes lectures at SNDT University also. She has conducted many seminars and workshops on psychological assessments for psychology students, supervises students from various universities, including Mumbai University, SNDT, TISS, Christ University, Gandhinagar Forensic Science University, when all the psychology students do their internship at Science Hospital. And so let's listen to Alpa and learn a little bit about intelligence tests. Over to you, Alpa.
Yeah. Thank you so much, ma'am. At the outset, sorry for the glitch, the technical problems that we sometimes face. But I would like to thank Dr. Ashmin Chodera for giving me this opportunity uh, to continue or to teach the various psychological tests. Today, we are going to talk about intelligence tests, basically. So, the question that basically comes to one's mind is what does one consider intelligence to be? There are now different abilities, different, things that are involved. Somebody says it's the marks that we get, it's the grades that we get that comprises of the intelligence. So, somebody getting good marks is an intelligent individual. Or somebody would say somebody being good at music, somebody being good at some experiments, scientific research, and whatever. So, what is intelligence basically? And how does one define intelligence? Now, intelligence basically refers to mental abilities that one needs to select, adapt to, and shape one's environment. That is, it is the global capacity to perform effectively and efficiently in an environment. So when we are talking about intelligence, we are talking about the various abilities that are involved, the various profits that we get from the experiences that one has, the ability to solve problems, to reason effectively and meet various challenges and achieve goals. So Wechsler in 1939 defined intelligence as a global capacity of an individual to act purposefully, think rationally, and to deal effectively with the environment. So he basically had to say that one an individual would be intelligent based on not only the academic or the theoretical knowledge that he has, but also how he applies that particular knowledge to your day-to-day functioning and your ability to solve various problems. Now, Thorndike basically states that intelligence would include three independent abilities. So we talk about abstract intelligence, where it involves higher order thinking or the ability to verbal and symbolic thinking. Mechanical intelligence is basically the ability to effectively control your body and manipulate various objects. And then we talk about social intelligence, where it is the ability of the individual to communicate with people, understand, and perform in social relations. There's always been a big question as to whether intelligence is hereditary or environment. Is it the gene or is it the environment that determines our intelligence? So there has been a long-standing debate about this, and it is both the genetic as well as the
Excuse me,
environment.
Alpa. Can I
Yeah.
interrupt?
Yes. Yes.
Uh, are you showing any slides? We can't see your slides.
Oh, yeah. I am sharing the slides, ma'am.
No, we
One
can't see
second.
your slides.
Now.
Now we
Now.
can see and go
Ha
to
ha.
full screen mode,
Yeah.
slideshow.
Yeah.
Okay, you can go to slideshow on top if you.
1 second.
No.
Right.
See in your, yeah, below you can see.
मैम राइट साइड कॉर्नर पे उसके ऊपर मैम.
ये
No, so where your
is this?
no Alpa, you can go to file, home, go down, no, go
नो
down.
मैम राइट साइड
Yeah, right side
170% के
below, below.
170% के लेफ्ट में मैम.
सॉरी हाँ उसके लेफ्ट में.
Yeah,
ये
true.
वाला.
Yes, correct.
Yeah,
That's
now?
right. Okay,
Yeah,
thank
alright.
you. Yes,
Thank you so much.
yeah, yeah.
So basically, like I was saying that there is this big question which has been going on for ages together, whether it's genetic or environmental. So yes, we cannot definitely say it's only genetic or it's only environment. To a certain extent, heredity plays a part, and also even the environment. Would play an equally important part. Like, let me give you an example that genetically a person may be intelligent, okay, but he may not have had an opportunity to probably go to school or college or something. So, would we consider a person not exposed to education as not being intelligent? No, it cannot be so. Like, for example, if we look at the mechanics at those who repair car garages, वगैरह, they have not really done automobile engineering, but when a car comes to them, they can just look at it, hear the sound and decide what is wrong, and probably are able to deal with the fault that is there and correct it as well as an automobile engineer would do. So it's not only heredity that plays a role, but also environment that plays an equally important role. Now coming to intelligence tests, what are intelligence tests? An intelligence test is basically a method of assessing an individual's mental aptitude and comparing them to those of others using a number, using a numerical score. So we always get an IQ score that we are, getting in a numerical form. Now, why do we need to conduct intelligence tests? IQ tests are important basically to assess and diagnose intellectual disability as well as learning disabilities. It helps us to determine what an individual knows and what an individual is able to do. One can compare an individual's ability level and achievement level. So very often we get patients, who are not performing well. But the parents may say पहले अच्छा था अभी अच्छे से नहीं कर पा रहा है. So we need to know whether is it because of a low intellectual capacity that the individual is not performing, or are there other emotional factors that are interfering with his performance per se. So what is the individual's ability as well as the achievement, and basically to measure an individual's intellectual potential. Now, the purpose of an intelligence test is that to obtain the individual profile as to his weaknesses and strengths. Okay, so whether we have verbal domains, we have performance domains, and whether some individuals are good at verbal, they are able to express orally, verbally, but some of them may not be able to do so. But at the same time, when you give them some activity, some kind of a performance test, they are able to perform quite well. So here, while doing a test, we are able to know the strengths and the weaknesses. What are the areas the individual is good at? So whether it's math, whether it's language ability, whether it's memory, whether it's sequential ability. This is what we are able to get from an IQ test. The test centers around a set of sorry, uh, the test centers around a set of stimuli designed to yield a score based on the test maker's model. So, depending on the intelligence test that we are using, we are going to get a score. And the IQ provides us with an overall profile of the test taker's intellectual potential in the domains that are being measured. Now, while we are testing, we need to keep certain things in mind. Uh, the testing must help us to recognize who might benefit from early intervention. So, children who have had delayed milestones or are coming with us with some other kind of, other handicaps accompanied with intellectual disability. So, if we know what the IQ is, it can help in therapeutic purposes or rehabilitation, like when children are having delayed milestones. The child, the autist, if he's referred to an occupational therapist, the occupational therapist might want to know what category the child is fitting in intellectually, and then the treatment plan can be decided accordingly. But we need to be careful that this does not become a literal measure of a person's worth or fixed potential. This we see very commonly, na, that if a person achieves 80 and 90, he is intelligent, whereas a person achieving something like 35 or 40 is not so intelligent. And when we conduct an intelligence test and give an IQ score, then it's kind of like, okay, he's falling in the mild intellectual disability. So if I have done the testing and I have given my report, and there is another, he goes to another psychologist or a psychiatrist or something and shows the report, then there is some kind of a bias that may come in our minds when we are repeating a test. कि, अरे ये तो mild intellectual disability है. So maybe with therapy, with rehabilitation, the scores might vary 5 to 10 points here. So we tend to kind of label an individual as being low intellectual, uh, a person with low intellectual capacity. So, intelligence test scores reflect only one aspect of the personal competence. We cannot decide that a person is good or bad just based on the IQ scores, because we are testing particular things or particular abilities in the IQ test, but he may be excelling in other fields which do not comprise in the category of the intelligence test that we are conducting. Okay, now what there are when an individual comes to you for testing, there are some factors which are going to affect the test performance. Basically, it could be internal factors or external factors. Internal factors could be like they could be hearing impairment or visual defect, or the individual may have had brain damage, or emotional factors like the child might be very shy or timid, or very hyperactive or very restless. There could be language handicaps, there could be speech defects. So if there is stuttering or stammering, the child might, be very conscious while giving you the responses. And if he does not respond, then you are going to score as he doesn't know it, and it definitely affects the IQ score that we are going to be giving. External factors that we talk about are, there could be a lot of distraction around, the child may be distracted. There could be some kind of scoring errors that could be there. There could be errors in the tests themselves. And of course, the skill of the examiner is equally important as to how you are conducting the test. Okay, so the question that arises are intelligence test bias. Yes, to a certain extent, we would say that they are biased because the tests are kind of based on a particular culture, and there may be others who are not familiar with that culture, so they would be at a disadvantage. But it is very difficult, for a culture-free test also. So, what are the intelligence level that, before I go on to what are the various intelligence tests, I would just like to touch upon what are the various levels of intelligence, because when you get a score, you need to know what level the child is. So, if the score on an intelligence test or a, social quotient or a developmental quotient falls below 20, it is considered as profound intellectually disabled. These children would probably have a accompanied handicap, maybe language or visual handicap or spasticity or something. They are quite dependent on probably, the parents for all their needs, self-help skills, daily activities, all of that would be have to be taken care of. 20 to 34 is severe intellectually disabled. 35 to 49 is moderate intellectual disabled. These children would probably go to school, would be able to do well up to the third or the fourth standard, and then the parents would complain he's not doing so well. There is scholastic backwardness, poor performance academically, and all that. And they can be, vocationally trained, but they would require constant supervision. They cannot do things by themselves. 50 to 69 is mild intellectually disabled. These children may perform academically well up to the sixth standard. They are trainable and educable. So they could be trained in some kind of activity. Vocational rehabilitation would help. Like, if they're given some kind of work, trained in some kind of work, they are able to do it. Certain activities they are able to do by themselves. They are not really dependent totally on the parents or others at home. 7 to 70 to 79 is borderline intellectual capacity, where we call them the slow learners. These individuals would definitely have academically problems after the seventh or the eighth standard. But we have the option of a national open school for them, where they have a curriculum based on the capabilities and their intellectual ability. Plus, they have an option of, if they're not performing well in languages or maths or something, they have an option of a vocational subject, so they can kind of excel in some other field and maybe not academically. 80 to 90 are the just below average. 90 to 110 is average. 111 to 120 is above average. 121 to 130 is superior, and 130 plus is the genius category. The extremes are always a little difficult, because we think that only the intellectually disabled are the ones who have problems. No, the higher the intelligence, they to themselves may have some other issues. Like, if it is a genius, the syllabus may be too easy for him. He may be asking a lot of questions where the teacher might not be able to answer those questions, and then like he feels like a misfit in the class. He already knows what the teacher is teaching, and they do have their own set of problems also. So let's come to the various types of intelligence tests. We have a list of them. We have Binet Kamat's test of intelligence, Wechsler's preschool and primary scale of intelligence, the WISC, that is the Wechsler's intelligence scale for children, the Wechsler's adult intelligence scale, Malin's intelligence scale for Indian children, Bhatia's battery of performance test of intelligence, Vineland's social maturity scale, and Raven's progressive matrices. So let me elaborate on each of the tests. First, coming to the Binet Kamat test of intelligence. This is the Indianized version of the Stanford Binet test of intelligence. It is one of the oldest intelligence tests in India, and it has subtests from ages 3 to 22 years of age. And this test can be conducted even on adults, because sometimes the students, when we teach, they ask us if the age limit is still 22. So if we get a patient who's above, 22, or if he's 30 or 40, then can we use this test? Yes, this test can be used even for them. But the subtests that are there on this test are from ages 3 to 22 years of age. And every age includes 6 questions along with 3 alternative questions. And basically, this test, the domains that are measured are language, memory, reasoning, conceptual thinking, visuomotor, and social intelligence. On this test, the IQ is calculated by mental age upon chronological age into 100. These are some of the items that we see on the test. Like, for every age, there are different, like, for example, at 3 years, they have questions like show me your eyes, point out your nose. We show them various objects and ask them to name the objects. But as the age increases, the difficulty of the questions also increase. So at around 8 years, we ask questions like mental mathematics, like, if you buy something for 4 rupees and give the shopkeeper 10 rupees, how much money will you get? So as the age increases, the difficulty of the questions also increase. Okay, coming to the Wechsler's intelligence scale. The Wechsler's intelligence scale was developed by David Wechsler, who was a psychologist at Bellevue Hospital. His initial test scale was published in 1939 and was designed to measure intellectual performance by adults. He constructed the Wechsler's Bellevue intelligence scale based on his observation at that time, And whatever existing tests were available, and he made adaptations of those tests for the children and for the older age group. And his test basically comprised of two groups of subtests, the verbal subtest and the performance subtest. The verbal subtest scales measure general knowledge, language, reasoning, and memory skills, whereas the performance measures spatial, sequencing, and problem solving skills. Now, in 1939, three scales had been developed. So we have the Wechsler's pre-primary school, preschool and primary scale for of intelligence, which is for children from 2.5 years to 7 years, 7 months. The Wechsler's intelligence scale for children is from 7 years to 15 years and 11 months. And the Wechsler's adult intelligence scale is from 16 years onwards. Now, the various subtests for all the three, categories are the same, but here only the difficulty of the items increases along with, according to the age. Okay, so the verbal subtests comprise of general information, which is basically covering various, general knowledge questions like in the WISP, like you have questions like which animal gives you milk or what is celebrated on 15th August. So here it is testing the general fund of information of a child. General comprehension is where how an individual will react in a particular social situation. Like, for example, you find a wallet fallen on the road, then what will you do? So the expected answer would be, you try to locate the person, or you try to, report it to the police or give it to the police or some authority who can, reach it to the right person. Arithmetic consists of test items, which again consists of all that we have learned in school, like addition, subtraction, multiplication, division, square roots. All of this is oral mental mathematics without the use of paper and pencil, and there is a time limit for it. Then similarities comprises of where we give two items to the individual. We ask him, how they are similar. Like for example, a mango and a banana, or a shirt and a frock. So they are supposed to tell us how these items are similar. Then vocabulary is where we give them words, and they are expected to kind of, tell us the meaning of those words. Digit span, we have digit span forward and backward, where we, say digits in a jumbled order, and the patient is expected to repeat them as it is. So in digit span forward, we say numbers like maybe 3, 1, 5, 7, 9. So he has to repeat it after us. In digit span backward, we ask them to repeat the digits that we say in a backward order. So if I say 283, he has to say 382. And then we go on till we are able to see up to what level he is able to remember. Okay, and word reasoning is where we give them words and they are able to, they have to kind of give us the reasoning behind that. Where the non-verbal or the performance subtests are concerned, first is picture completion, where we show them certain pictures and something is missing in that picture, and the child has to tell us what is missing in that. Picture arrangement is where we give them a sequence of card, telling a story. So they have to arrange those pictures in the right order or in the right sequence. So here we are testing the sequential ability of the child. Block design is where we give certain blocks to the child, and on a card there are certain designs that are there, and he has to use those blocks to make the same design. Object assembly is like where we give them puzzles. Okay, like there is a face or which are in pieces, and he has to rearrange it as a whole thing. Mazes is something like we have probably solved it sometimes in the newspaper. We see there are three houses and there are three people, and the whole thing is entangled. Of course, this is a very broad example that I'm giving. On this test, we have definitely certain design mazes that are made, and the child has to use the pencil and come out or go into it. And digit symbol is like coding, where there are certain alphabets written on top and some symbols below those alphabets, and then there is a whole page of jumbled alphabet, and the individual has to see and put in the appropriate symbol below the alphabet. So here again we are talking about eye-hand coordination and how quickly the child is able to do it. Here on the Wechsler's intelligence scale, we are getting a lot of clear-cut, uh, bifurcation of how the child is, what the child is good at, and what the child is not good at. So here we are getting a full-scale IQ, we get a verbal IQ, and we get a performance IQ. So verbal IQ is got, I mean, it has two subdivisions: verbal comprehension index, which is covering vocabulary, similarities, information, and comprehension, the score on that. Working memory is where we are talking about arithmetic, digit span, letter number, and sequencing. So that is the verbal component. And the performance IQ, we are seeing perceptual organization index, which is covering the picture completion, block design, matrix reasoning, and processing speed index, that is digit span, digit symbol coding, and symbol search. So on the Wechsler's intelligence scale, we are getting a lot, information about all of these various abilities. So whether the child is good at vocabulary, arithmetic, information, or the performance score is better, the verbal score is better. What are the strengths and the weaknesses on this test? We are able to get a very clear picture. Okay. Coming to the Mallin's intelligence scale for children, this is the Indian adaptation of the WISP by Mallin. He based it on the general model of David Wechsler's intelligence scale for children, and this test is used for the Indian culture. Certain items that were there in picture arrangement, the pictures were more of foreign or situations. So they kind of adapted it according to the Indian culture. Again, this test is can be used for the age group 6 to 16 years. And here again, we get a verbal IQ, we get a performance IQ, and a full scale IQ. So again, here the subtest that we see on the Malins is the general information, comprehension, arithmetic, similarities, vocabulary, and digit span. Okay. Whereas the non-verbal is picture completion, block design, object assembly, coding, and mazes. So here, when we are scoring, the digit span can be used as an alternate test. Yeah. Coming to the next test that we talk about, that is the Bhatia's battery of performance test of intelligence. Now, very often, like when we get cases, there may be somebody who is not able to speak or is deaf and mute. So then, how do we, assess them? Like because they will not tell us or they will not speak, so they will not be able to respond to the questions that we are asking. So this test can be used with individuals who are, the less educated, illiterate, and the deaf and mute population. This test was constructed by C.M. Bhatia in 1955, and it was developed to test the intelligence of the Indian population. The main objective of the test is to measure intelligence of children who are less educated, those who haven't been to school, and the deaf and the mute population. The subtest from this is the course block design, which is similar to what is there on the Wechsler's intelligence test, where certain cards are shown and blocks are given, and the child is supposed to, make the design that is seen on the card. Alexander pass along test is where there are uh, the second image that you can see here. It's like an Alexander, that is the Alexander pass along test, where you can see that there are some blue blocks and a red block. And what we do is we put the blue block towards the red line and the red block towards the blue line. And we tell the child that to move these blocks to the other side without lifting them. Okay. Then we have the pattern drawing test. This is something that probably we might have done in school. Sometimes that, without lifting the pencil and without going over the line, you have to draw the design that is shown on the card. So there are 8 cards of each pattern, and the child has to draw those without lifting the pencil. Then digit span forward and backward is like what it was on the Wechsler's scale or the BKT. And the last is picture construction test, where there are, pictures of various sceneries or designs that are there, and the child has to arrange them to form the entire picture. Yeah. Then we have the Vineland social maturity scale. Now, very often we get children who are, below the age of 3 years, and sometimes an expected thing is that how do we assess these children? So, the Vineland social maturity scale was developed by Edgar Doll in 1935, and the Indian version of this was again adapted by A.J. Mallon in 1965. This was designed to assess social intelligence and development of an individual. So this consists of 8 domains, and we have 89 items. And we basically ask the parents that whether the child is able to perform these activities. Like for example, 0 to 1 year, we ask questions like whether he is able to stand by himself, whether he babbles, whether he is able to grasp object around in his hand. Then as the age increases, like, we ask questions of whether he's able to recognize people, whether he can color with a pencil. So the 8 items, 89 items are inclusive of these various domains. That is the self-help general, which is covering things like whether he can have a bath by himself, whether he is able to eat by himself. So general self-help skills that are there. Then we have self-help eating, whether he eats by himself, whether he drops, whether he's able to eat with a spoon. So, then whether he's able to dress himself, that is self-help dressing, self-direction, occupation, communication, locomotion, and socialization. So the questions that are asked to the parents are revolving around these 8 domains, and depending on the responses that are given by the parents, we are able to get a social quotient. Okay, so here the social quotient is determined by social age upon chronological age into 100. Like on the BKT, we had mental age upon chronological age. On the VSMS, we are getting a social quotient. Um, this is a test which is totally based on the responses given by the parents. So, to a certain extent, the reliability of this test is questionable, because very often when we ask the parents कि वो बैठता है क्या, अपने आप से खड़े रहता है क्या, बटन लगा सकता है क्या, तो very often they will say हाँ कर सकता है. Now there are certain items which we can check, like for example बटन लगा सकता है, and if the parents say yes. So if we have doubts, we can ask the child to, button kholo, button band karo. That we can check. But there are certain activities which we may not be able to check over there and then. So we are not sure whether the parents, are over reporting, or sometimes they might under report in terms of ये सर्टिफिकेट मिलेगा. अगर हम बोलेंगे कि ये नहीं कर पाता है तो वो कम आएगा स्कोर, बिकॉज they discuss with other parents, or there are somebody in the neighborhood telling them कि आप इधर जाओ, वहाँ पे आपको रिपोर्ट मिलेगा, सर्टिफिकेट मिलेगा, तो ये फायदा होगा, वो फायदा होगा. So sometimes there is under reporting or over reporting also happening, because sometimes parents will say हाँ मेरा बच्चा सब कुछ कर पाता है, because they want to show that okay, my child is normal, whereas we can actually see that it may not really be so. Then we have the Ravens progressive matrices. The Ravens progressive matrices was developed by John C. Raven in 1936. This test basically assesses the abstract reasoning and intelligence of an individual. This is a kind of multiple choice test, and the client has to identify the answer that would fit in the incomplete pattern. So there are 3 versions of the Ravens. One is the standard progressive matrices, one is colored progressive matrices, and one is advanced progressive matrices. Standard progressive matrices is used for individuals 16 and above. Colored is for individuals from 6 to 16, and advanced is a higher version of the standard progressive matrices. So it is something like this. This was developed in 1938, and again it is used among the Indian population. This test consists of 5 sets, that is A, B, C, D, E, and each set consists of 12 items each. Okay, these are black and white in color. Now you can see in this example that there is the design that is there, and there is a blank space, and there are 8 alternatives that are given, and the child has to choose the correct alternative doing abstract reasoning. So he has to reason out what would be the correct answer on this. So in this way, there are, for every set, there are 12 items that are there. So an individual can get a score of 60 maximum on this. Okay, this is the colored progressive matrices. You can see that it is colored. Okay, this is black and white. This is colored. This was designed for younger children and maybe even senior citizens and individuals with moderate intellectual capacity or physical disabilities. You can use this test. This test has 3 sets, A, B, and B, and again each containing 12 items. So there are a total of 36 items, and the items here are colored. So here again you can see that there is a design, there is one part which has been removed, and there are 6 alternatives that are given, and the child has to tell us what is the correct alternative, and there are 12 items in each set in this test also. In the advanced progressive matrices, it is much more difficult. Okay, it consists of 48 items. In set 1, there are 12 items, and set 2, there are 36 items, and the items go on increasing with difficulty. The standard progressive is much easier, but as the sets increase, the difficulty of the items increases. Similarly, this is much more advanced, and there is much more difficulty in the items that need to be solved. Again, these are on in black and white. Okay. Yeah. So these are the various intelligence tests. Now, basically, when we are giving a report, okay, you need to understand the report, because you may not administer the test, but you need to understand what the report is telling you. So when we write a report, initially, of course, you need to mention the demographic data. You need to mention who the child has been referred by, what was the reasoning or the reason for referral. Okay, what were the complaints that were given. Of course, we all know it's important that before doing any kind of testing or anything, again, we need to take a detailed case history before we do assessment. Establishing of rapport and all of that is important. And then we need to describe the test. What are the tests? What is the test that we have administered? What are the test results, or what is the score of the IQ? What range it falls in? Whether there are any discrepancies that we see, whether there is any scatter in the scores that we see, and what are the strengths and the limitations. So when you look at an IQ report, you will probably on a BNA Kamat, you might just see a score, and you might see that, okay, the IQ is falling in this particular range, and maybe he has performed well at this age level and not performed. So we get a basal age, we get a terminal age, and we get the mental age, and we get the IQ. So yeah, that is important. And here, of course, you know the strengths and the limitations that are there. So very often on the Wechsler's intelligence scale, when you read a report, you will definitely get a much more detailed report in terms of, whether the child is good at maths, or he's having difficulty in expressing or languages or something like that. So it's very, very important that we know that. One thing I'd like to mention here is that I mentioned that we are doing the IQ test to kind of assess the intellectual capacity and know how a child is performing. But it could also be learning disability, and the Wechsler's intelligence test would give us a clear idea about it in terms of if there is a discrepancy of more than 20 points on the verbal IQ and the performance IQ, then we can suspect that it could be learning disability, and further educational tests and other tests can be done to help us diagnose learning disability. So yeah, this is about the various intelligence tests that we cover in our curricula. I mean, in our when we are doing our testing, and I think most of you, when you are referring, probably you all refer के हाँ मैम ने बोला है कि IQ test करवाना है, so referred for IQ test. But why do we do it, and when what test is required? I guess there would have been some clarity about the various intelligence tests that we are having this week.
Wow,
So
that
yes,
was really
and we
comprehensive, Alpa. And thank you so much for such an informative talk. I'm sure many people have questions and their practical difficulties which they face in day-to-day practice. So if anybody wants to ask question, they can unmute themselves and ask, or they can write in the chat box and I will communicate the question to Alpa. Anybody who would like to begin? Okay, I think I'll ask a question to you, Alpa. Which is the
yeah.
best IQ test? Is there anything like the best IQ test?
See, ideally, I think the Mellon's or the Wechsler's intelligence scale gives us a very comprehensive picture about the strengths and the weaknesses of the child. So here we get a very clear-cut picture कि उसको math में difficulty है या languages है difficulty or he's having difficulty sequencing, eye-hand coordination. So based on that, maybe remedial or rehabilitation, whatever needs to be done, I think that would be something that would really help in even getting a clearer picture where academics is also concerned and where the child's strengths and weaknesses also lie. So I guess Wechsler's intelligence scale or the Mellon's intelligence scale would be something that I would consider, as being one of the best.
Yes.
But then again, we decide based on the child who has come with you with difficulties, and we have to decide based on whether he would be able to perform on the Wechsler's intelligence scale or the Mellon's, because for that some kind of education is required, and if the child is illiterate, he might not be able to perform so well on it. So the scores would go down.
Yes, that's very right. And I also completely agree with you. Now, there is a question from Neha. She wants to know, should we ask questions in English as given in manual, or we can change the language of the questions?
No, no. What happens is because we are in a BMC setup, we don't get all English-speaking patients. So yes, we do translate the questions in the language the child understands. Because very often that language barrier might be there. He might not understand English, and he might know the answer, but because he does not understand what you are asking, he is not answering. So the score may go down.
So,
So then
just a
we
corollary to
can
that, Alpa, are there any versions of, say, Wechsler's that have been translated and validated in Indian languages?
the Malins that is there, but again, that is only in English. We go like
What
the
about WIS
Wrestlers and
3?
Yeah, this three, the Mahendrika Bhatt version has a Gujarati translation also and has, yeah, so WIS 3 definitely has, WIS 4, no.
WIS 4, no. Okay. Uh, Anybody else? How can we assess IQ in blind children? That's a very good question.
Yeah, I think I forgot to put in the Segwin form board
Yeah. Okay.
test. Yeah,
Yes.
I forgot to include that. That's basically a board that we have which has certain blocks with shape. Actually, I should have put it and the picture would have made you understand it much more easily. So we have the Segwin form board which has blocks, okay, with different shapes like a triangle, a star, oval, circle, a plus sign. So we can ask the child, he can remove the blocks and he's supposed to place them. So that with the touch, he can do it. Or we can do a VSMS.
Right.
That's another alternative because if he is not, but a blind person, if he, because see, there are children going to blind school, so they are taught.
Yes.
Okay. So
Yes.
they might even respond on the BKT if you attempt.
Yes.
It's not that they cannot respond on that
Correct.
because it's just that they cannot see. So we on the BKT, that is the Vinay Kamath test, we have alternative tests. So those which require a visual, looking at the cards and responding, we do not use those. We use alternative tests to that.
Right, like auditory stimulus,
Yes,
touch, etc.
yes, yes,
So,
yes.
similar to this, somebody has asked, Madam, any comments on SFB, Sanguine Form Board?
Yeah, segment
Since,
form board. Yeah,
yeah,
so
yeah.
segment form board, we give it to the child and he has to remove those blocks, and we ask them to fit in as fast as possible, and we time them for free trials. And then we have the total time taken, and we have a manual which converts the time taken into the mental age. And then again, IQ is computed mental age upon chronological age into 100. So here, how quickly the child is able to put the blocks into the appropriate, you know, places. That is how we are going to determine.
Yeah. Okay, one very common question I think that gets asked is, see, the items are till the age of 15 in some IQ tests, etc. And
Yes,
can you use or even better, the formula is mental age upon chronological age into 100. So how
yes.
do you apply the formula in adults?
Okay, yes, that's a very good question.
Yeah.
Uh, the chronological age when the child is beyond 16, that is when it is an adult, like a 30-year or a 40-year, the chronological age is taken as 16
15,
only. 16.
16, right.
One, yes, 1 6. So that is, it is believed that that is the age where the maximum intelligence can be developed. Beyond that, it's just experience, and like there is no increase as such in intelligence. But on the test that we are using, especially the Binet Kamat test, the chronological age is taken as 16 only, irrespective of um, the individual being an adult. So, and the questions are till 22. So the average IQ, it would be either average or above average that the individual will do when we compute the IQ.
I guess this
Depending.
problem will come when we are using the formula of mental age upon chronological age.
No,
But
ma'am.
when
No,
we,
ma'am. Yeah.
no, in the sense, but when we take the absolute test scores and calculate
Yes.
the VCI and PCI, I think this problem may not come, right?
No, no. On that it will not come, because in that there is a manual, and it's again a time bound test, and then the scores, we get a raw score, we get a scaled score, and then there is a manual which is converting those scores into an IQ based on the age, based on the age. So,
Right.
so there is no problem with computing the IQ there, because
Right.
it's already the IQ, the same scores at a particular age may show a higher IQ, but at a higher age will give you a lower score,
Yes, yes.
because
That is
as the
something
age
I wanted to
increases.
ask you. Does the IQ differ as the age advances, or
Mm.
do the reports convey something different as the child grows older and older and we do the test again and again?
See, when an individual is of an average intellectual capacity or above, there would be no difference. Okay,
Yes.
there can be a variation of 5-10 points in the IQ here or there. That's all right. That's acceptable. Like supposing if I do it and somebody else does it, the IQ may vary by 5 to 10 points. That's all right. But when we talk about the intellectually disabled, okay, when they are lower, maybe the IQ would be falling in the mild category. Okay. But
Yes.
as they grow older, and when we compute the IQ, they can go to the moderate.
Yes.
Uh,
Yes.
so it is quite possible, yes.
Yeah. I guess it is due to the difficulty level
Age.
of the items
Yes, yes,
also,
yes.
right?
And plus the increase in the age, because we are
Yes.
computing the IQ based on the
Based on
mental
the
age upon
younger age.
chronological.
Right.
Yes, yes.
Okay, there is one more question by Neha. What is the eligibility of learning disability? Should we take full IQ scores, that is verbal and performance, or we should take individual verbal and performance scores? So when
No,
we
like,
take the IQ, yes, yes,
yeah.
Alka.
So for us to diagnose an individual with learning disability, first of all, the full scale IQ has to be of average or above average intellectual capacity.
Right.
And and a discrepancy between the full verbal IQ and the performance IQ score. So the
Right.
discrepancy has to be between that, but the full scale IQ has to be average or above average. A child of below intellectual capacity may have difficulty in learning reading, writing, maths, and whatever, but that is due to low intellectual capacity. Okay, and a person, when we are saying is having learning disability, the individual is having a normal IQ, average or above average IQ, and but still having difficulty in reading, writing, and math.
Okay. So what happens, I think what she means is that a
Hmm.
child is there who's in, say, 8th standard. His verbal
Okay.
IQ is 120 and his
Hmm.
performance IQ, or rather the other way around. The verbal
Right,
IQ
right.
is 88 and
Huh.
performance IQ is 120,
Right,
right? And that
right.
pulls down the full scale IQ.
Yeah, but it would still, but the full scale IQ would still be in the average category now.
Okay.
And overall, we see it, no, it will still be in the average or the above average, the full scale. But we need to do further educational tests for us to really diagnose.
Yes,
We cannot base it only on the IQ. It just
true.
points towards leurning disability.
So can you
Only with
name
the
a few
bachelor's.
educational achievement
Yeah,
tests?
yeah, yeah. They basically use the Woodcock-Johnson test or the curriculum-based tests that are there.
Yes,
So those are educational tests that can be used, which would give you a clearer idea as to what area of difficulty the child is having, whether it's reading, whether it's writing, whether it's mathematics, or whether it's all three or a combination of maybe reading and writing. So when we are diagnosing learning disability, it's not based only on the IQ, the Wechsler's IQ. We have to do further tests to, correlate and find, diagnose it as having learning disability.
all right. Rashmin, we can go on like this because the question answer session is very interesting. Are there any more questions? Otherwise, I'll ask one last question.
Yes, ma'am.
Yeah. Okay. So the thing on my, okay, there is one more question by Dr. Samiksha. Do we have to always mention full scale IQ, even if it is lower than performance or verbal?
Yes, yes. You have to mention all the three. You have to mention the verbal IQ,
I think
the
in the report
performance
it
IQ, and
reflects. Yeah.
yes, it will reflect.
Yeah.
And the
Yeah.
full scale IQ, because the full scale IQ is telling you about the overall IQ, and verbal and performance is specifically pointing to the verbal components and the performance components.
True. Many times when we do academic educational achievement tests, the higher value of the IQ is taken into consideration and is considered as the true IQ of the child. And that is why I think both these questions have come up. Neha's also, and even Dr. Samiksha has
Yes,
asked from that point of view, I believe.
yes, ma'am. Yes.
So I guess there are no more questions, but what is the difference? The one last question, I think that is also something that we ourselves will have to answer a number of times to parents especially. What is the
Yes.
difference between an intelligence test and an aptitude test?
Okay. Intelligence test is basically based on the ability, the achievements. I mean, so it is covering, the mathematics, the language components, the memory components, the cognitive abilities that we talk about. Whereas an aptitude test is specifically assessing the various aptitudes in terms of, every test is done like a space relation, mathematical ability, abstract reasoning, verbal reasoning, language ability, and verbal reasoning, abstract reasoning. So there are 8 subtests that are there on the aptitude test, and there is an interest inventory that we also give along with the aptitude test, and sometimes even an intelligence or a personality test is done. And then we take a combination of all the scores, and it helps us to, guide a individual in terms of what career he is likely to be good at. Like, for example, if somebody wants to go in for medicine, So probably his, the biological part, or somebody wants to go in for engineering. So the space relations or the mechanical reasoning, that should be good. If that is not good, he is definitely going to have difficulty performing there. Okay. So, or if somebody wants to be a teacher, so the language ability, the scores on those should be higher. Verbal ability should be good. So, when we are in a aptitude test, when you are trying to help somebody choose a career, there are combination of scores that are taken, and then the interest inventory is also telling us what the individual is interested in, and basically then we are kind of try to guide them as to how what kind of field the child can go into or he can be successful in.
Okay.
So intelligence test is just giving you a score about the and it is more focused on how he's performing academically, and this is the achievement. Intelligence is dealing with achievement, and aptitude is talking about all the various abilities that a child may have or an individual may have.
Yeah, that's a very good way of explaining it. Thank you, Alpa. The session was really excellent, very comprehensive, and you included most of the points that are relevant to IQ tests. I think there is one last question that has come up. Can we use VSMS on adults? Or if we
Yes.
can, what should be chronological age, 15 or
16.
16? Yeah. Can we use VSMS on adults is the
Yes,
question.
we can use it even on adults. And the chronological age would be considered as 16. For the BKT and the VSMS, the chronological age we are taking as 16, not the actual age of the individual.
Right. Thank you so much. Thank you, Alpa. Rashmin, over to you.
Yes, thank you. Thank you very much, Alpa. It was brilliant as expected, and it was quite a comprehensive coverage of all different aspects of the psychological testing, the intelligence part of it. But then now you've kind of whetted our appetite, so we will insist on having you back next week to talk to us about the personality testing. And I'm sure it'll be as interesting, if not more, than it was today. So thank you very much, Alpa, for a comprehensive talk and quite lucid, quite informative, and quite interesting. And of course, thank you, Janvi, for making it quite interactive, adding your valuable inputs and giving us a whole new perspective to how we have to go about it. And thank you, the audience, for being here in such large numbers and participating very actively. We are grateful to all of you for your continued support and interest, and we promise to continue to bring you more and more interesting topics as we go along. Thank you all once again. Thank you, Alpa. Thank you, Janvi.
Thank you.
Thank you so much, sir.
We'll see you
Bye-bye.
back
Thank you
again
so much,
next
sir.
week. Thank you.
Yes. Bye-bye. Bye-bye.
Bye. Wish you good evening, everybody.
Good evening.
And thank you, Sunfarm, for their continued support. Thank you.
Yeah. Thank you.
Thank you, sir.
Thank you. Good evening. Bye.